Are you still going for that yearly test at 72? What if I told you it might be doing you more harm than good? Your doctor may mean well, but at your age, one more test could lead to a diagnosis you never needed, a treatment you didn't ask for, and a problem that was never even real. This channel is for the late bloomers, the ones starting over when the world thinks it's too late, for those rebuilding after divorce, searching for meaning in retirement, or learning to breathe again after heartbreak. Here, we talk about life after 60, raw, real, and without the noise. Today, we're going to talk about 5 routine health checkups that many people over 70 are still doing without ever being told they might be unnecessary. Not only unnecessary, in some cases, they can cause more anxiety, more procedures, and even more harm. We'll look at what these checkups are. We'll hear from real doctors. We'll listen to stories from people just like you. People who learned the hard way. And by the end of this video, you'll walk away with options, with clarity, and most importantly, with the power to choose what's right for you. The 5 health checkups to rethink. Number 5, annual full body scan. Are you still scheduling that yearly full body scan just to be safe? You're not alone. It sounds responsible. It sounds like you're doing everything right. But let me ask you something. Has anyone ever told you what those scans are really finding? Because here's the truth most people never hear. Full body scans often pick up things that aren't dangerous at all. Harmless spots, tiny abnormalities, scar tissue, and once that shows up on a report, the dominoes start falling: biopsies, repeat scans, even surgeries. All for something that may have never affected your life at all. In one major study, over 30% of healthy adults who got full-body CT scans were told they had abnormalities. But guess what? Most of those didn't need treatment. What they did need was less stress, less worry, and a better informed decision. I want you to listen closely to this next part. Full-body scans in asymptomatic patients often lead to overdiagnosis. We find things we weren't looking for, and we treat problems that were never actually problems. That's from Dr. Angela Martin, a diagnostic imaging specialist. She sees this every week. Retired patients walking in for a peace of mind scan and walking out with a list of new fears. Let me share a story that might feel familiar. One of our viewers, David from Oregon, had just turned 74. Fit, active, no symptoms. His daughter gifted him a full body scan for Father's Day. The scan flagged a suspicious shadow on his lung. Panic set in. He spent the next 2 months in and out of hospitals, tests, appointments, even a biopsy. The result? It was scar tissue from pneumonia he had 20 years ago. No cancer. No problem. But 2 months of fear, over $4,000 out of pocket, and side effects from the biopsy that left him short of breath for weeks. So here's the question: if you feel good, you're not having symptoms, and no doctor is recommending it, do you really need that scan? Here's a better way. Listen to your body. Focus on targeted testing when symptoms show up, not when fear tells you to go looking. Talk to your doctor about a smarter strategy. Symptom-based evaluations are not only safer, they're more personal, more accurate, and less likely to drag you through unnecessary procedures. Now I want to hear from you. Have you ever taken a test and later wondered if it was worth it? Did it lead to a path of more scans, more stress, more confusion? Leave a comment below. I'm not just saying that. I read every single one. Your story might be the one someone else needs to hear today. And if you're watching this on screen, have you ever regretted a medical test? Let's see how common this really is. Number 4. Routine colonoscopies after 75. A lot of people believe that if something worked for decades, it should keep working. But colonoscopies after a certain age can quietly shift from helpful to harmful. Let's get this straight. According to the U.S. Preventive Services Task Force, routine colon cancer screenings, including colonoscopies, are generally not recommended for adults over 75, especially if they've had normal results in the past. Why? Because the risks begin to outweigh the benefits. It's not that colonoscopies aren't effective, they are. They've saved lives. But as we age, the chances of slow-growing polyps becoming dangerous shrink, while the risks of the procedure itself climb. Now let's talk about what those risks actually look like. Sedation, bowel perforation, bleeding, infection. You don't hear about those in the waiting room brochure, but studies show that in patients over 75, these complications become more likely. And when they happen, recovery takes longer, often weeks, sometimes months. And that's just the physical toll. There's also the emotional hit, the anxiety from follow-up scans, extra biopsies, or false alarms that lead to even more procedures. We call this overdiagnosis when we find something that's technically abnormal but never would have harmed you in the first place. Let me tell you about Maria. She's 79. Her doctor insisted on one last colonoscopy just to be sure. The procedure found a small polyp, benign but just a bit concerning. She was sent for a follow-up in 6 months. That test came with complications. Her colon was accidentally perforated. She spent 4 days in the hospital. Months later, she still deals with digestive pain. And the original polyp? Still benign. Still harmless. Now, does this mean no one over 75 should get a colonoscopy? Not exactly. But it means you should pause and ask your doctor if it's really necessary based on your history, your current health, and your preferences. There's a gentler alternative you should know about. It's called the fecal immunochemical test, or FIT. It's non-invasive. No sedation. You do it at home. It checks for hidden blood in your stool, a possible early sign of colorectal cancer. And if something shows up, then you and your doctor can decide on the next step. Sometimes a simple test is enough to give you peace of mind, without putting your body through unnecessary risks. Let's hear now from someone who sees this from the inside, Dr. Lyle Benson, a gastroenterologist who specializes in aging patients. In healthy seniors, we focus more on quality of life than aggressive screening. If your previous colonoscopies were clear and you're not high risk, we often recommend discontinuing routine scopes after 75. So take a breath. You don't have to do something just because it's always been done. And if you've had complications, or if you've chosen to skip your next colonoscopy, share your experience in the comments. There's no shame in trusting your gut and asking, do I really need this? You'd be surprised how many people are thinking the exact same thing. Number 3, annual PSA tests for prostate cancer. Still getting that PSA test every year? Let's talk about that for a moment. Just you and me. Because this one is tricky. The idea behind it is good. Prostate cancer is serious, and early detection sounds like a smart move. But after 70, the conversation changes. And most people aren't having that conversation with their doctor. Here's what many aren't told. PSA levels naturally rise as you age. A slightly elevated number doesn't always mean cancer. And even if cancer is found, it's often so slow-growing that it wouldn't cause any issues in your lifetime. But once that number shows up on a test, the snowball starts rolling. Next thing you know, you're having biopsies, maybe surgery, hormone therapy, radiation, all with real side effects. And the worst part? Some of those treatments might have been for a cancer that never would have affected your health in the first place. Let me say this clearly, false positives are common with PSA tests, and the treatments that follow can change your life, not always in a good way. There's a story I want you to hear. One of our community members, Jerry, he's 74 now, had a PSA test that came back mildly elevated. No symptoms. He felt fine. But his doctor sent him for a biopsy just to be sure. That biopsy found a very low-risk cancer. Still, the word cancer shook him. So he went for treatment, radiation. 6 months later, Jerry was dealing with fatigue, loss of bladder control, and intimacy issues that changed his relationship with his wife. Not because he was sick, but because of a chain reaction from a test he may not have even needed. That's not fear-mongering. That's his reality. Now, what's the alternative? Instead of automatic yearly PSA tests, many doctors now recommend a risk-stratified approach. That means looking at your individual health history, symptoms, and age. If you're not high risk, no family history, no symptoms, it might be safer to skip the annual test or at least space it out. And if you do get tested, make sure you understand what a higher PSA number really means before jumping into action. You are allowed to ask, "What's the rush?" Let's take a quick pause here. I want to ask you something. Have you ever taken a test and later regretted it? Maybe it led to stress, pain, or a procedure you weren't even sure you needed. Drop a comment below and tell me about it. I read every single one. You never know. Your story could help someone else rethink what routine health really means. Number 2, bone density tests every year. Still getting a bone density scan every year? Let's pause for a second. Because here's what most people don't realize: not everyone needs that test annually, especially after a certain point. DEXA scans can be helpful, sure. They measure bone density and tell you if you're at risk for osteoporosis. But unless you've had a major change in health, a fracture, or just started treatment, getting one every single year might be unnecessary. In fact, most guidelines suggest spacing them out every 2 to 5 years for stable patients. But here's the catch. When that scan shows even the slightest decrease in bone mass, many people are rushed into medication. And that's where things can go sideways. Let's talk about that. Bisphosphonates. Maybe you've heard the names Fosamax, Boniva, Reclast. They're often prescribed when bone loss is detected. But these drugs can come with serious side effects: jaw problems, digestive issues, bone pain, even rare fractures. And sometimes they're prescribed for osteopenia, which isn't even osteoporosis, it's just a warning sign. I've had viewers tell me they started a medication they didn't feel comfortable with, just because one scan showed a minor dip. No conversation about diet, no mention of exercise, just straight to pills. But here's the thing, you're not powerless. There are powerful natural alternatives, backed by science, that can help support bone health without jumping straight to medication. We're talking about a mix of calcium-rich whole foods, vitamin D from the sun, or supplements, weight-bearing movement, and resistance training. Yes, even light strength training can make a huge difference, even at 70, 75, 80. And don't think it's too late. I want to introduce you to someone from our community, Linda, 71. 2 years ago, she was told she had osteopenia and was advised to start medication. She decided to take a different route. She adjusted her diet. More leafy greens, more sardines, fewer sodas. She started walking with a weighted vest, doing balance exercises, and lifting light weights 3 times a week. Last month, she messaged us her latest scan showed her bone density had improved. Not just maintained, improved. No medications, just small changes done consistently. Her doctor was surprised. She wasn't, because when you take charge of your health, things change. So I want to ask, have you ever felt pressured into starting a treatment because of a test? Or have you made changes naturally and seen results? Share your story in the comments. You'd be surprised how many others are going through the same thing, wondering if there's another way. And if you're just now realizing you've been testing out of habit, not need, it's okay. You can slow down. You can ask questions. That's what this space is for. Number 1. Annual EKGs without symptoms. Still doing an EKG every year even though you feel perfectly fine? Let me ask you something, who told you that was necessary? Now don't get me wrong. EKGs can save lives. They're essential when you're having symptoms like chest pain, dizziness, shortness of breath, or an irregular heartbeat. But getting them every year with no symptoms, no history, no reason? That's a whole different story. And it's one that often ends with fear instead of clarity. The truth is, routine annual EKGs in healthy older adults can lead to what doctors call incidental findings. These are little irregularities, minor blips on the screen, that might look like trouble, but mean absolutely nothing. Still, once something shows up, the wheels start turning. More tests, more cardiology visits, sometimes even unnecessary procedures. Let me tell you what that looks like. James, one of our longtime viewers, is 76. no symptoms. He eats well, walks every day, never had heart issues. But during his annual physical, his doctor did an EKG. The results came back abnormal. Just that word alone had James losing sleep. He was referred to a cardiologist, then a stress test, then a heart scan. Each one came back okay, but the process lasted 3 months. And in those 3 months, James stopped exercising. He stopped sleeping. He couldn't shake the feeling that something was wrong. Turns out, it was a completely harmless variation. His heart was fine, but his confidence, his calm, that took longer to get back than any test result. So if you're healthy, symptom-free, and not at high risk, you might not need that EKG every year. In fact, most guidelines don't recommend routine EKGs for screening unless there's a reason. Instead, focus on blood pressure, cholesterol, movement, and how you feel day to day. But if you do notice changes, tightness in your chest, shortness of breath, unusual fatigue, that's the moment to act. That's when the test matters. Before we wrap up, let's hear from Dr. Nina Harris, a cardiac specialist who works specifically with EKGs. Are amazing tools when used correctly. But for someone with no symptoms and no risk factors, the benefit of yearly testing is minimal. In fact, we see far more stress caused by false alarms than by actual heart problems. Let's take a deep breath here. So what have we talked about today? The annual full body scan, which can lead to false positives and fear. Routine colonoscopies after 75, where risks often outweigh benefits. Annual PSA tests, which can trigger life-changing treatment for low-risk findings. Yearly bone density tests that often push medication before lifestyle changes. EKGs with no symptoms that cause more anxiety than answers. You are not a number on a chart. You're not a scan or a reading or a red flag. You're a whole person. With a history, with wisdom, with the right to pause and ask, do I need this? If this opened your eyes, tap like. It helps more people find this message. And if you're rewriting your story after 60, I invite you to subscribe. This isn't just a channel. It's a space where late bloomers grow deeper roots. Now look after your heart, not just the physical one, but the one that still dares to hope, to start fresh, and to live smarter. This stage of life isn't about more fear. It's about more freedom. So let's open the conversation up. What's one test you've had that you'd consider dropping now? What would it feel like to say, I don't need this every year anymore? Drop it in the comments. This isn't just a video, it's a community. A place for people over 60 who are done being told what to do with their bodies and are ready to take control calmly and wisely. And if this helped you see things differently, tap like. Share it with someone who's always been the good patient but is starting to wonder if good should mean asking more questions. And if you're navigating this beautiful, brave chapter of life, subscribe, like, and share. This space is for you. We're not winding down, we're waking up. Together.